Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are talking to Allison Guste, who is the Corporate Vice President of Nursing and Clinical Services at LCMC Health and the Chief Nursing Officer at the University Medical Center New Orleans, about her career and her thoughts about trends in the nursing industry. So, hi, Allison, how are you?
Good. How are you? It's nice to be with you.
Yeah, I'm doing well. Thank you for asking, and thank you for taking the time to do this.
My pleasure.
Um, yeah, so let's jump right in. How did you begin your journey into nursing?
So, my mom was a nurse, and my grandmother was an assistant in a physician's office. And so
Mhm.
it always really piqued my interest. And I watched my mom be a surgical nurse for many years when I was a child. And it seemed to be a really gratifying profession for her. So I set my sights on nursing very early. I waffled a little bit in college. I thought about being a dentist, but
Mhm.
eventually settled on that I definitely wanted to be a nurse. So started out my nursing career. I went to LSU School of Nursing here in
Mm,
New Orleans, and so I haven't gone very far from home. And I actually started my career at LCMC Health as a nurse tech.
very cool. I'm originally from New Orleans, so I've got a bunch of family who went to LSU.
Yeah,
It's a great school.
it was great.
Yeah. So who have been some of your biggest influences?
Oh gosh, there's been so many along the way. I think surprisingly, I, I've had different levels of influences, different professionals in my life.
Mhm.
Number one, my mom for her nursing career. She started it all for me. And then I've picked up different influences along the way. I'd say one of my biggest mentors is actually a physician. And she was with me when I worked at an ambulatory practice and was the chief of OBGYN at the time. And she
Mhm.
was really influential in creating me in an administrative role and helping me learn, grow, and pushing me to be better. And so Dr. Young was amazing.
Nice. Very good to hear. So, what was your best mistake and what did you learn from it?
Well, there's probably two. I would say, from a clinical perspective, I made a medication error early in my career, and it was due to lack of communication. And I learned very quickly how easily those mistakes can be made. I was very lucky that there was no harm to the patient, but of course, it scared me and it changed my practice. So I think that was number one. Other mistakes along the way is not communicating as well as I should have in a professional role. And
Mhm.
I can't emphasize enough is how much you have to communicate and how many different ways it's important. So I've learned to try to determine the best ways to do that going forward.
Absolutely. Yeah, I studied communication in college, so could not agree more.
We could all use some of those classes.
Absolutely, yeah. So, what do you think are the biggest challenges currently facing CNOs?
There's many that the CNO community needs to worry about. We know that healthcare is always changing, and if you're
Hmm.
not changing, you're probably going to fall behind. So, but workforce shortages, I don't think that's a surprise to anyone. I don't
Hmm.
think just in the nursing field, but in the allied health profession and all the support services. Post pandemic, rebuilding your staff and addressing burnout at the same time has been a big challenge. And then just keeping pace with the rapid change in healthcare,
Hmm.
technology in particular. Technology is always changing. There's always a new and greatest technology out there that we're asking our staff to adapt to. But I think
Hmm.
ensuring that that technology works for the nurses and not adding extra work, it needs to be a value add where it's taking something away, is where we can really use that.
Absolutely. So, you mentioned staffing issues. So, what are your thoughts on strategies for recruiting and retention to address the nursing shortage?
Well, recruitment and retention is the name of the game these days. And
Yes.
so at LCMC Health here in New Orleans, we are really working to create our own healthcare professionals pipeline. We
Hmm.
started a program called HPP, Healthcare Professionals Pipeline, where we are trying to bridge the gap and attract students into the professions of healthcare. we've partnered with at least 10 academic entities throughout our community to
Mhm.
provide scholarships, to create a more diverse workforce, and to really get people who wouldn't have maybe entered the healthcare path into that pipeline and help them develop and grow while providing the financial support. The retention, you know, we need to worry about being market competitive in our compensation. We need to ensure, particularly in the nursing field, that we're offering professional development,
Mhm.
keeping our nurses educated and up to date with their training programs outside of the hospital, even. And then creating more long term sustainable solutions, creative shift schedules, you know, being flexible with those types of things, creating new roles is all important in our retention.
Absolutely. So you mentioned creating a diverse workforce. So what role do you think diversity, equity, and inclusion plays in improving culture?
Well, I think diversity and opinion challenges us to do better in whatever we're trying to accomplish. Um, we need to create an environment that values different perspectives.
Mhm.
Particularly here in New Orleans, we need to have a community of nurses that reflects the community that we're taking care of. And so making sure they feel valued, supported, and motivated, leading to higher job satisfaction, hopefully leading to higher retention, but ultimately improving the quality of care and culturally competent care that we provide. Um, so I love the fact that our healthcare professionals pipeline program is focused on that diversity, and we've
Mhm.
seen great results from it so far.
That's great. You also mentioned burnout. So what can health systems do to increase overall nurse well-being and promote better work-life balance?
This is a tough one. I think burnout is a very tough topic because not
Mhm.
only are we burnt out sometimes professionally, but everyone post pandemic has a lot going at home. If you have
Mhm.
children that are experiencing difficulties after the pandemic. So it's not just at work, it's at home that we're having to make sure our nurses feel nurtured and cared for. Establishing a manageable workflow, a manageable
Mhm.
workload, and growing our workforce. So those three W's are all really important. Providing access, I think, to mental health resources for our staff is really important.
Mhm.
Being
Mhm.
proactive in our reach out and not just reactive is really going to be more rewarding for our staff. Creating that workforce environment that feels psychologically safe is also where they can speak up and
Mhm.
feel that they're valued is absolutely essential to your well-being.
Absolutely. And from the CNO perspective, with burnout, there was a recent study that came out that said, I think like 31% of nurse leaders are thinking of leaving their positions in the next year.
Mhm.
So how do you think CNOs can kind of stay engaged with their workforce and continue to be, satisfied with their careers?
So, what fills my cup every day is not when I'm in a lot of meetings.
Hmm.
It's really going out there and just rounding on the floors and seeing
Hmm.
the nurses do what they do best, and that's caring for patients. I also think that it's a big mistake that people might make if they don't go and get in front of a patient. Hearing the patient's
Hmm.
story really revitalizes me and reminds me of why I'm here in the long run. And so
Hmm.
being out on the units, not just with the patients, not just with the nurses, but with all the staff has really enabled me to realign my vision every day, give me
Hmm.
purpose, and align me back to that why I became a nurse in the first place.
Absolutely. So, how do you think that CNOs can leverage new technologies to kind of deal with some of these issues?
Well, I love technology. I'm always leaning on it here and trying to think of new and creative ways at LCMC we can leverage technology. Our landscape in nursing is really just poised for transformation in this space. And I
Hmm.
think we're seeing it happen before our eyes with telehealth and virtual nursing. I think that's going
Hmm.
to play a significant role in the future about how nurses deliver care. I equated it at a recent meeting that I was at of I think, when meaningful use came out and EHRs were starting to become a thing, people didn't want to
Hmm.
let go of those paper records. Um, and I
Mm.
think not having virtual nursing one day is going to be not having an EMR one day, the equivalent. I think artificial intelligence is going to play a major role, machine learning. It has
Mhm.
the potential to streamline so much of our diagnostic process, optimizing our treatment plans. I think also automating routine tasks and documentation that nurses do um, is going to be paramount to the nursing workforce. But for
Mhm.
patients, wearable devices, smart technologies, just being able to access your record from home, like you can do
Mhm.
on portals now, is amazing. And so when we look at our EMR at LCMC, it's how can the EMR support the workflow and not
Mm.
change the workflow to where we're having to redesign.
Absolutely. That's definitely a trend that I've been hearing with the CNOs that I speak to about how technology needs to be used as a tool rather than a
That's
replacement.
right. That's right. It allows them to work to the
Absolutely.
level of their license better too.
Absolutely. Yeah. So to pivot back to you personally, what are you most proud of?
Oh, I'm most proud of being able to represent and work with the thousands of nurses that have here at LCMC Health.
Mhm.
Um, Personally, I'm proud that my children get to watch me have a career that I love and that I can make a true impact.
Mhm.
And watching the nursing workforce, particularly here at University Medical Center, um, is is extraordinary. The level of expertise that they provide, the care that is given, the quality of our outcomes is
Mhm.
nothing short of amazing. And so that's what really makes me proud.
Absolutely. Those are great things to be proud of. So do you have any advice for CNOs?
Best advice: prioritize those things that your staff are telling you.
Mm.
I think the best thing as a CNO is be authentic in your leadership.
Mhm.
Truly listen to your staff. And when I say listen, I mean, I think we have an acronym that I used recently that's WAIT. And I learned this at a conference and it has really stuck with me. But WAIT is why am I talking? And so just wait and listen. And then what we do with what they're telling us is key. And so closing the loop either with why we can do something, why we can't do something, and finding those quick little wins for our staff to feel good about the care they're giving is
Mhm.
important. And lead with empathy. Um, don't ever forget we became nurses because we have empathy, and so
Mhm.
inspire collaboration, push towards transformation, and just everyday excellence.
Absolutely. Well, thank you so much, Allison, for your time. I'm really grateful to have had this opportunity to get to know you and hear your insights. And thank you so much to our audience for listening.
Thank you.